Okay. Hello, everybody, and welcome to the first webinar of our Evidence and Implementation Summit series leading into our Evidence and Implementation Summit 2025 next year. So I'm Robyn Mildon. I'm the CEO of the Centre for Evidence and Implementation, and we'll be facilitating this webinar today. Before I start, I want to acknowledge the traditional owners of the land I'm coming to you from. I'm zooming in from Australia, Melbourne, Australia, and I'm on the land of the Wurundjeri people of the Kulin Nation and want to pay my respects to elders past, present, and emerging. A few little housekeeping things, but those of you that have joined our webinars before, you'll be familiar with this. We love you to post questions. If you can post them, please post them in the Q&A. And I'll be watching that as we go to try and make this somewhat interactive. So post a question anytime you like. And we will make this somewhat conversational. We'll go for about 45 minutes and hopefully be super enjoyable for those of you that have been able to join us live. So I would love to introduce my partner in crime and our guest for this panel today, Dr. Suneeta Krishnan. And she's the Deputy Director of the India Country Office. And I'm going to read her fabulous bio, but I'm not going to read it all because it will take some time and embarrass her no end. There she is. So hi, Suneeta. So Suneeta is an overseas strategy, financial planning, business operations, measurement, learning, and evaluation for the Foundation's India Country Office. So she oversees all of those areas. No wonder we talk about how big our jobs are. For the India Country Office with the Gates Foundation. In this role, she supports teams within the office in using data and evidence to refine their strategies and program implementation and advance gender and diversity, equity, and inclusion goals. She also manages grant making to enhance research and evaluation capacities in India. I had the absolute pleasure of meeting Suneeta, I think last year, post a meeting that I was at where some of the Gates Foundation staff were at, and we hit it off like this in terms of good debates and good thinking around use of evidence and implementation and all sorts of stuff. So I'm really looking forward to this, Suneeta, and I appreciate you taking the time because I know how crazy busy your job is. If I can get you to start, and I'll just preference for the audience, both Suneeta and I have slight colds. So if one of us starts coughing or we have a lozenge, we apologize ahead of time, but we've got our water, we've got our lozenges, we're good to go. So Suneeta, please tell us a little bit about yourself, your background, and what you do at Gates, giving a better description than I just did.
Well, thank you so much, Robyn, for this opportunity to speak with you today. It's really exciting, and I'm really excited to hear the questions on the minds of folks who've joined us as well. So who am I? I'm a social epidemiologist by training. I was born in New York and grew up moving between a small city in the southern Indian state of Kerala and New York. My dad was an economist, and I grew up hearing about some of the exemplary advances that Kerala has made on the demographic and epidemiological fronts. And that included the role of women's education in advancing health outcomes, particularly maternal and newborn outcomes. I lost my mother to breast cancer pretty young. And all of this sort of led me to get really curious about women's health, and particularly to look at women's roles in health and social change. As an undergraduate, my capstone paper focused on the role of women nurses in Kerala's healthcare system. And then I went on to do a PhD in epidemiology and biostatistics at the University of California, Berkeley, where I also studied medical anthropology. And then I spent about 15, 20 years in a research career where I looked at the pathways through which gender and caste and economic inequalities end up influencing and shaping women's health over the life course. I joined the Gates Foundation about 8 years ago as part of the measurement, learning, and evaluation team. And since then have had the privilege of both supporting our program teams in adapting our global strategies to the Indian context, in using data and evidence to refine our strategies and our portfolio making and management, in service of supporting India's journey towards health and development goals.
That is an enormous job for sure. Just to sort of get us into the conversation, I was able to attend an event called the Global Evidence Summit, which was the second one that has happened in the last 7 years, I think, in Europe a couple of weeks ago. And there are a lot of foundations there from around the world trying to think through how evidence can or can't, and that is evidence from research and evidence from data, but also lived experience. And there was a lot of conversation around citizens' evidence, how it can and sometimes can't influence the way that they make decisions and help some sort of data-driven decision-making. So tell us a little bit about, in general, how evidence implementation data plays a part in the work you and the foundation do, and what does that sort of look like, if you've got a couple of examples?
Absolutely, I've got lots of examples. So let me start by sort of talking a little bit about the role of evidence across our strategy life cycle. Evidence is absolutely fundamental to the way we set our strategy in terms of understanding the kinds of problems that we as a foundation can contribute to solving. So, we look at the data and the evidence to understand what are, for example, in the space of maternal newborn health and helping women and newborns survive. We use evidence to understand what are the biggest challenges that face women and newborns, for example. Where are those challenges concentrated, in which geographies? What kinds of drivers shape those challenges? And then we sort of look at what are our comparative advantages as a private philanthropic foundation? What kinds of resources can we bring? We have our voice, our convening power, our ability to mobilize technical expertise, for example, our ability to spark innovations, to offer novel solutions. So that's at the strategy level. We have processes that we use to make and manage our investments and portfolios of investments. And here too, we ensure that data and evidence are embedded into the milestones that we're looking to meet and to track as we implement those investments and track their progress. So we create feedback loops where we're able to bring the data back to inform the progress, our assessments of progress, and to also understand whether the initial theories of change that are underlying those investments are actually playing out in the way we had anticipated that they would. And if they're not, we identify course corrections based on what the data tell us. And linked to this is systems thinking. A lot of the problems that the foundation has chosen to work on, both here in India as well as globally and in other countries, are typically fairly complex and sometimes even wicked problems. And so a lot of times we go into making investments, portfolios of investments, without having a very clear line of sight to what is that pathway to impact. What are the specific solutions that can help solve this wicked problem? We pose hypotheses, and then we use data and evidence to learn as we go, and then to navigate.
Yeah. And tell me a little bit more about what sort of, so evidence can mean different things to different people. And so what sort of evidence does the foundation, or do you use in your work? Is it one-off randomized controlled trials? Is it systematic reviews that, as you know, are a collection of trials that are looked at to see what seems to work and what doesn't? Is it trials that also combine local data? Just tell me a little bit more about that, and then I'm a little bit about context, because you and I have had good conversations about how much that matters.
Yeah, so we use all kinds of data and evidence. We're not wedded to a particular method or tool. So, for example, when we entered into a partnership with the government of Uttar Pradesh, which is one of India's largest states in the north of India, has a population of nearly 240 million. We were invited in to partner with the government to engage in a technical assistance initiative that would advance reproductive, maternal, and newborn health and nutrition goals. This was about 10 years ago. When we went in to better understand, initially, we needed to understand what are the major challenges or problems that are affecting these outcomes and that need to be addressed. One of the key pillars of the system is human resources. So, the idea was to go in and look at, well, is the government of UP having adequate number of human resources for health? And it turned out that the government of UP was actually struggling to get an answer to that question. So initially, we went in and did a comprehensive assessment of the human resources that existed in the system. But quickly it became apparent that this is quite dynamic. There's attrition, there's recruitment, human resources change over time, they get credentialed, et cetera, et cetera. So it became very clear that the UP government actually needed a robust, ongoing, real-time system to capture this data. And leaning on sort of the experiences of other states in India that had grappled with this problem, we identified a digital solution that the UP government could adapt and implement themselves. That solution is called Manav Sampada, and now provides a ton of real-time information on HRH, which has in turn unlocked a whole slew of reforms that have led to an increase in the availability, quality, as well as rational distribution of human resources in the state. So there's helping governments capture sort of routine administrative data. Then, one of the challenges that UP faced was that the quality of labor and delivery care was not sufficiently good enough to prevent maternal and newborn deaths. So there had been reforms earlier in India to incentivize and promote women's use of institutions to deliver. As women came into the institutions to deliver, it became clear that the quality of care that they were receiving needed attention. The foundation had supported in sort of the mid-2010s an approach called nurse mentoring, which has to do with bringing expert nurses into primary healthcare facilities to coach and mentor systems professionals, nurses in the system, to improve their labor and delivery practices, to adopt global best practices in labor and delivery. And that was tested through a randomized controlled trial, a cluster randomized trial. Facilities were randomized, and the net result of the trial was that actually this relatively cheap intervention, which involved sending a nurse mentor into facilities, could actually translate into quite substantial improvements in labor and delivery outcomes. And so we were able to pick up that evidence-based intervention and bring it to UP, but the health system context in UP was very different. And so the environment in which nurses at primary healthcare facilities were offering services was quite different from the environment in the state of Karnataka, in terms of the readiness of the facility to actually provide the care that it needed to provide. So it quickly became clear that we had to adapt that particular intervention to the UP context, but we also needed a lot of additional information to understand how best to adapt that intervention to the UP context. And so that's where context comes in, and that's where implementation research comes in as well. We couldn't rely on the results of the randomized trial alone. We needed a whole lot of other kinds of information.
That is a terrific example, a really, really great example of how context does really matter. And a very deliberate focus on quality and implementation. So when you and I met, we talked a lot about the what matters in terms of evidence-based interventions, if you like, or other types of innovations, but the how can matter even more when you're trying to move innovations around. So I love that example, and also the attention that the foundation or the works of your team is giving to readiness, which is a very big context in implementation research and implementation science, that we sometimes have to assist people and sites to be ready. And the reference you make to very careful adaptation, but the need for adaptation. So being thoughtful about that. I think for many countries that are implementing innovations that were outside from wherever the innovation was first conceived, it's just vital, as your work is demonstrating with the foundation. So I really appreciate that as an example. And the acknowledgement for the need for technical assistance without calling that capacity building. So I certainly know at the Global Evidence Summit, there was some concern about capacity building being seen as a one-way thing from one country to another and not a two-way, and then the move away from those terms to be talking about technical assistance and transferring use of data. So those are just terrific examples. We've got a couple of questions. You're going to love the first one because of where you're from. Kerala is a very favorite place and to be seriously admired for its work on the status of women and education generally. What would you identify as the major system interventions that have brought this to bear? And I'll just link that question it's a terrific question, because that also plays to the role of implementation science and systems change. And what can we learn really facilitates things, which I think is what the question is getting at, and what we know about what are barriers to implementing things. So if you go ahead, and compliments to the question.
Perfect. Thanks, Robyn, and thanks for that question. Kerala has a particular history in terms of, its pre-independence, pre-colonial rulers, the influence of Christianity, the influence of trade with the West and China and many other countries, etc., that brought many different kinds of ideas to Kerala. There have also been very important caste-based movements that have occurred in Kerala as well, all of which are really important and to understand and acknowledge in the context of looking at Kerala's demographic and health transition. All that said, Kerala has also made deep investments in a couple of things. One is in education. And so there's, near universal literacy in most parts of Kerala. And literacy in turn unlocks, sort of the demand side of healthcare. People are informed, they're able to access information and then to demand services as well. Second is state of Kerala has also invested in primary healthcare. Kerala benefits from the fact that it is a smallish state and very highly densely populated. So proximity to primary healthcare centers is also relatively high. The investment in primary healthcare has meant that there's been investments in the context of maternal newborn health in robust antenatal care provision, in access to facilities for labor and delivery. In fact, most labor and deliveries actually occur at fairly high-level facilities in Kerala, not at a primary health center level any longer. But they've, because of the literate population, also the influence of the past influence of movements and so on, there's also been a tradition of women in Kerala, for example, going into the nursing profession. Yeah. So this is in contrast to Bihar, where we also work, where when we started out over 10 years ago and wanted to bring in this idea of nurse mentoring, there were insufficient number of women, well, nurses are largely women, and even though that's changing in India today, but there were insufficient number of nurses from Bihar who could be recruited in to serve as mentors. Now, those are the kinds of challenges that Kerala has not had because of the investments in education, the production of human resources for health, but also the investments in the health infrastructure.
Again, a really nice example of how context really matters and how system infrastructure can help or hinder any implementation efforts of things that to support people's outcomes. I'm getting some good questions in here, so I'm going to move to another one and then come back to a related one. So I'll go to this one first. It's a two-part. What has been the journey to building trust in the evidence base drawn upon to inform interventions or programs delivered through the foundation? That's part one. So what's been the journey in building trust in that? And maybe that's been a good journey or not a good journey. So, and then second, what are some examples of routines or processes which get and keep busy policymakers, government officials interested in implementation?
Great questions. So building trust, I think it starts with building trusted relationships. A lot of our work has been in support of the government of India, and particularly the government of the states of Uttar Pradesh and Bihar, where we've been providing technical assistance. So working in an embedded fashion where, the teams that provide technical assistance live and work in the states of UP and Bihar. They're not flying in, flying out. They live there. They understand the context. They're working side by side with government counterparts. And so really understanding the constraints that our government counterparts are working within, and helping our government partners identify feasible solutions within those constraints. And that process has, of course, involved generating data and evidence. Producing those data and that evidence side by side with government by, first ensuring that the questions we're asking are resonating with the users of the data, and taking them along in terms of, the identification of the methods and so on, enables that trust to then emerge. So trust emerges as you listen and you respond to the needs of your key stakeholders. And when you're able to bring usable, actionable insights back to them, that builds trust, and then it's a virtuous cycle. That's one. Second is a lot of our technical assistance has focused on how to improve the system's own data. So we're not making parallel investments or investments in parallel data systems and bringing in outside agencies to collect data and then to go share truth to the government, for example. We're helping the government ensure that the system is generating good data that they can use, right? Believable, credible, accurate information. So the technical assistance is really focused on how do we ensure that the grassroots health workers and providers who are collecting a lot of that data actually understand what that data is for, why it's important, how they themselves can consume the data, and then how it can flow within the system right up to the policymakers. So it's a journey, and I think our recognition is, and you like this one, the recognition is the importance of ensuring that the data and evidence generation activities are again truly grounded and are engaging the key stakeholders actively in the process. We're not ideating the research questions sitting here in the foundation offices in Delhi or somewhere, outside of UP and Bihar. They're getting ideated in that setting, and they're getting implemented and brought back. So that was your first question. And I've already forgotten the second
I can help with again. So you sort of went there a little bit. So, but what are some examples of routines or processes which get and keep busy policymakers and government officials interested in implementation? So not taking their eye off that, which we all know, and I'm sure a number of people on this webinar know how common that can be for reasons that we all know.
Yeah, I think a couple of things. One is, actually, so a lot of my responses are limited to the public health context. Again, it's my lived experience and my expertise. Foundation works on a number of other areas in India beyond health, but I'll limit to health. Within the health context, the government and policymakers actually already have routines to enable them to keep their eyes on the ball. So, for example, right from the district level up to the state level, there are routine review meetings that happen to review progress on different programmatic fronts. Our technical assistance has actually focused on helping those routines become truly effective. How do we ensure that the improved administrative data is actually getting pulled in and visualized in the right manner for a district review meeting or a state review meeting, right? So part of the assistance has been to build the capacities of measurement and learning and evaluation officers in the government, actually use simple tools like Excel to build salient reports off of administrative data on a monthly basis. And it's also about helping the government identify key problems, challenges, and then helping them unpack those challenges. Maybe that's through a systematic review, or it's through a landscaping exercise, it's a set of stakeholder engagements, et cetera, and bringing that evidence back to help them with the solutioning. I think at all times it's really important, one, to be aligned with the government's own agenda and mechanisms and routines, and helping those become more effective, because actually a ton of thought has already gone into setting up those systems. So how do we just ensure that those systems are working in the way they're supposed to be working? And second is, when we gather data and evidence, ensure that we're actually effective in our storytelling. And I think that's another major part of what we are trying to do is in partnership with our technical assistance partners and academic institutions and other evidence organizations here in India, really do a better job of gathering insights out of that data and evidence and presenting it in a compelling way. I think a lot of times we don't do justice to the storytelling. We do our fancy studies. Maybe it's a really, beautifully executed randomized controlled trial, but we're not able to take the results and then explain, so what? And what next? And I think that's a little bit on us as, the people who work with data and evidence, that we don't do well enough. And then of course, policymakers have 301 things on their to-do list. If we're not effective and pithy in our communication, they're going to move on to the next problem that they need to solve.
Yeah. It's funny you mentioned storytelling. So again, at the Global Evidence Summit 2 weeks ago, that came up an enormous amount, the need for storytelling. And there's a fantastic group, and I can't remember what their acronym means, but PACE, they're in South Africa. They were having this week a whole storytelling festival using evidence and data to try and sort of work and align with policymakers. So it's obviously a hot topic. I've got a slightly related question, and there are way more questions than we are going to get to, but I appreciate it's just terrific engagement you're getting, Suneeta. So what about the role of politics, power relations, and interests in shaping both what research evaluation is funded in the first place and in the uptake of findings?
Yeah, that's a deep question. I mean, we can't get away from the fact that power and politics pervade everything we do, including, how research agendas get set and then carried out. I think from my vantage point within the Gates Foundation, we are very committed to addressing issues of inequities. And, that's driven, for example, our commitment to working in partnership with the governments of Uttar Pradesh and Bihar, where, there's some of the poorest communities experiencing the highest levels of maternal and neonatal mortality and so on. And so and this is addressing inequities and advancing equity is a cross-cutting sort of principle and lens we apply to every programmatic area that we engage in. And by doing so, what it does is it focuses the questions that we ask, and therefore the research that we are investing in or the data that we're looking at to, to address the concerns of those who are most disadvantaged, those who are most vulnerable, those who are experiencing the most adverse outcomes. And I think that grounding is really important, because once you're grounded in that fashion, then you navigate the politics, the power equations, etc., such that you're laser focused on this. These are the folks that you're concerned about and that you're working to support, and that becomes your driving principle, and puts everything else in perspective. So one can't get away from issues of power, the fact that data and evidence and research today are more contentious than ever. You can look at the same piece of information from multiple points of view and arrive at different kinds of truths. And I think the only way to corral that kind of chaos in some sense is to be grounded in the values and the principles that drive your work.
Yeah, no, I think a number of people on this can really relate to that. I'm going to switch as we come sort of to the last sort of 10 minutes of the webinar, and ask you this, which has been a popular question. Can you build a bit more on how you apply systems thinking to what you do? Thank you. And I think what's behind that question is people talk about, often we talk about implementation science, people talk about systems change. I say sort of same, don't get too, but it can feel like this sort of lofty. So if you've got some examples or some ways to sort of make concrete how you apply that, that'd be great.
Absolutely. So I already gave you one example in the context of Uttar Pradesh when we entered in or initiated the technical assistance. Became very clear that having a handle on the human resources available within the health system was like a key data point. And that was also going to be an important potential leverage point for system improvements. Because the ability to actually encourage women to utilize antenatal care services, the ability of the system to actually offer high quality antenatal care and labor and delivery services, all of those things hinged on having a sufficient number of health workers in the system. So, the initial assessment helped identify where are those key leverage points within this complex system that we could enter into and assist the government to then unlock future opportunities for systems improvement. So by actually enabling the system to better understand their human resources situation, it then allowed for all kinds of reforms to then be developed, reforms that have enabled the government to recruit more specialists in, reforms that have allowed a more rational distribution of resources, particularly to underserved areas, et cetera, et cetera. So one way in which you use systems thinking is doing very robust initial assessments as we initiate technical assistance activities to identify what those key leverage points are. Second is recognizing that theories of change are going to evolve. Because as I said, when we came into Uttar Pradesh, we came in with a couple of different hypotheses based on, for example, the experiences of our partners in the southern state of Karnataka, but they had worked actually in districts in the north of Karnataka, which in many ways would have looked like districts in Uttar Pradesh or Bihar. High levels of poverty, relatively low levels of institutional deliveries, low prevalence of antenatal care, etc. And in Karnataka, we had identified sort of, interventions that would address the demand side and improve outreach to communities to popularize antenatal care, and then mentoring nurses in primary healthcare centers to follow best practices in labor and delivery as two critical interventions. When we brought them to Uttar Pradesh, that was the initial hypothesis. We can strengthen community outreach and strengthen primary healthcare labor and delivery services. Quickly became apparent that the Uttar Pradesh context was quite different, that there were challenges in their supply chain system. There were, of course, these fundamental challenges in human resources, etc., that actually needed to be addressed in order for these particular interventions to be effective in this context. Now, that insight was obtained through careful measurement. Come in and you pilot these interventions, and then you measure all of the things that are going on around this intervention, right? In terms of, okay, well, are these facilities actually ready? Well, it's not even just facility readiness, it's actually bigger system readiness issues that emerge. So very careful measurement and testing of those initial hypotheses. Again, the testing is happening in real world settings, not in a controlled trial sort of context. It's happening, so therefore it's implementation science, right? But then we're willing to modify our theory of change and evolve the investment as well. So the focus of the technical assistance had to shift, and it had to shift to help the system address some of these other systems issues, which we had not originally intended to address when we went in. So systems thinking means that you are agile and that you're constantly, measuring what's happening in that context and understanding the different dynamics, and then evolving your theory of change and the work that you're doing in response. So it's a very evolutionary way of working. And it's a way of working that emphasizes learning, that you go in, you're not wedded to your initial theory of change. You are critical about and analytical about your theory of change. You're testing it, and then you're adapting it. And I think this is one of the comparative advantages of our foundation, is that we are willing and able to make these longer-term technical assistance investments where our partners have that flexibility and the space to learn more about what the system actually needs, and to then evolve in response.
And related to that then, beyond joining me on webinars like this, how do you, because again, at the summit, there was a lot of talk that evidence-informed or evidence-based thinking and research-informed implementation is about learning. And it's about exactly, evolving. And how does the foundation share this learning? Because that's quite technical, what you were explaining there. And that's really where people are talking about we need to get, but in a lot of places we're very far from. So how do you share that with others? There's a fair few questions related to quite technical things, people asking how the foundation does particular things. So how do you share that in such a concrete way that you explain that case study? Is there somewhere people can go? Where do they get more?
Yeah, so our partners have, are amazing learning organizations, and they've really evolved, particularly with our health work over the last 10 years. I would say we're very good at learning and evolving our technical assistance, our investment making. We've been less good about sharing our learnings with a broader audience or a broader community that works on these kinds of issues. And we're just beginning to tackle that. I think we've been very heads down, like trying to get the work done. And we've reached a point as well where I think we can look back and really understand, oh, okay, this is what we actually did. This is how we've evolved. And, it coincides, I think, with where, the evaluation field is as well, in terms of course, we've always, we've had developmental evaluation approaches for some time, but bringing systems thinking into evaluation as well. So we're in the process now, actually, of developing some of these more meta narratives about our technical assistance efforts and what have we learned from that. What have we learned from our work with health systems in particular? And then we're also developing case studies. And interestingly enough, I've spent the last all day yesterday, about 8 hours, and all morning today, about 3 hours, with some of our flagship partners who've engaged in this work to actually dive into some of these knowledge products that we've started to draft, and we're in the process of refining them.
Yeah, and I think that's another important contribution. As you know, CEI, we're not attached to a university, but we work with a lot of universities, and it can be hard to get that good translation learning out because we're also focused on the doing, but it's important so that we again can accelerate the closing of the gap between things people could get now and what they're actually getting in real world policy and programs. So that was terrific. You got excellent engagement in the questions. I apologize to those of you that posted questions that we couldn't get there in total. But Suneeta, any final words of if I never did this again, things would have changed, or gosh, I wish we did more of this, but just sort of final sort of inspirational closing remarks. No pressure.
Oh, wow. No pressure. Actually, I hadn't really thought about an inspirational closing ahead of time.
Lots of people like to hear what not to do, so it doesn't always have to be positive.
Yeah, I think, what I have learned over the last 8 years of doing evaluation at the foundation, sounds kind of trivial, but one is to stay really humble and stay really curious. I think as an evaluator, like the tendency, at least in my initial years, was to come in and evaluate, sort of, actually pass judgment at times as well. And it goes back to the systems thinking question, which is, I think when we're working on complex problems with systems, it is so critical to stay humble and stay curious. There is always a nuance that you haven't quite figured out or captured, and really the devil is in the details. It's in the nuance. Context matters. The answer to any question almost is it depends. And so I think the humility to recognize that as a researcher, as an evaluator, I only have like 20% of the understanding that my colleagues who are actually engaged in technical assistance and deep in the programs know. And it's really my responsibility to help tell that story of complexity in a way that's accessible and usable by others. So that's what animates me, and that's what I love about the job that I do.
Yeah, that's excellent. Well, thank you again very much for that. As I said, we had over 45 countries join you on this with over 480 registrations. So there's obviously huge interest in the foundation, your work, and the history of your personal work. So we appreciate your time. Thank you for everybody who joined. This will be recorded, so you can send it on to whoever you like when it goes up on the Evidence and Implementation Summit website. And appreciate a lot of you joining from, you're getting a lot of thank yous. I don't think you can see them, but some
Thank you so much. Yeah, I loved the conversation.
Thanks, everybody.